Hello, Northeast Texas. I'm Dr. Craig DeLisi with Titus Regional Medical Center. As you know, we've been fighting an invisible enemy in our community for the last 7 months. By now, I assume that everyone watching has been affected by the coronavirus in one way or another. The state of Texas has the dubious distinction of being the first state to reach 1 million cases. We also currently lead the nation in number of patients hospitalized. And we've seen plenty in our own backyard. At the Family Care Center alone, we've seen over 1,000 cases, and we've had over 200 patients hospitalized at TRMC since May. And I've lost count of how many patients I've had that were the sickest they've ever been. We understand a lot more about COVID than we did when this started. Thankfully, we're better at managing it and treating it, but the threat is still very real and people are still getting very sick and dying. Like most healthcare workers, I'm tired. I'm tired of long hours and sick patients. I'm tired of watching those I care about suffer. And yes, I'm very tired of death, of which Texas has had more than our fair share. And I know you're tired. You're tired of change and the new normal. You're tired of distancing and limiting activities, or the things you can't do. And it's safe to say we're all tired of wearing masks. I haven't done any social media posts or public service announcements in months because things have been pretty stable. And frankly, I've been very busy. But I'm here today requesting your help. In the last several weeks, we've seen a sustained spike of COVID-19 in our state and our community. Hospitalizations in Dallas are up 40% over the last 10 days alone, and we're seeing similar trends here. Just today, we have 13 COVID patients in the hospital, including 4 in the ICU, and we're starting to see an average census comparable to what we saw during our peak in May. The demands on our clinics are exceeding our capacity. And while we're not shocked by this, it is nonetheless extremely concerning, especially this early in the fall. Most of us in the medical profession assume that the worst is still ahead of us. The announcement by Pfizer a couple weeks ago about their vaccine was tremendous, and Moderna's announcement on Monday was even better. Those of us fighting for you feel like we can finally see the finish line. And though only the Lord knows precisely when all this will be behind us, I feel like we're very close and suspect by spring to be in a much better and different place. Dare I even say, a normal place. But we're not there yet. And until then, the recommendations are still the same. If you're exposed, stay home and self-quarantine for 2 weeks from your last contact with a positive individual. If you're sick with COVID, it's a minimum of 10 days before you can go back to work or school or the community. And everyone needs to take precautions that we all know by heart: distancing, hand washing, wearing masks, because these things truly help. I want to briefly address 2 groups of you out there. The first are those of you who have been extremely cautious from the beginning. First, I want to say thank you. I know that living that way has not been easy and has come with great sacrifice. My encouragement to you is to please persevere. In combat, soldiers are taught that complacency kills. And against this virus, complacency will result in more illness, hospitalizations, and death. The second group are those of you who have been less cautious, or maybe not cautious at all. You decided that the threat is past, or perhaps is not real or substantial to begin with. To you, I respectfully say that you are wrong. COVID-19 is an infectious disease that is real and more deadly than any common contagious infection that we've seen in our lifetime. It is not the flu, and it is not a religious liberty issue or political debate. Yes, there are plenty of people who get it and have mild symptoms, but to date, it has taken 250,000 American lives. That number represents real people, some of whom I cared for and cared about. To put that in perspective, we lost 400,000 lives, American lives, in all of World War II. Maybe you're not personally afraid of falling ill to the virus or even of dying, and that's okay and good. I'm not either. But please know that this is not solely or mainly about you. Your actions will affect those around you, and your inaction may ultimately result in greater spread of this infection. I fear that as more and more people adopt a laissez-faire attitude regarding the pandemic, the effect will be profound. For the first time in my 20 years as a physician, I'm dreading the winter months ahead. I'm concerned that we're on the precipice of a preventable catastrophe. To all of you, I'd like to say that while we can't and shouldn't stop living, we can continue to live carefully, not as hostages to fear, but wisely and cautiously, considering others before ourselves. We can avoid large gatherings and keep our distance from others in public, and we can all wear a mask, even when we're not required to, even in church. There are a lot of voices out there saying so many different things. I think most people do not know what is true or who to trust anymore. Truth has become a word that means little and a commodity that people use for selfish gain. But if you can't trust us, those of us here in our community committed to helping you, then I'm not sure you can trust anyone. So please, I implore you, help us to help you. Those of us at TRMC and other hospitals in our region continue to stand ready to fight until the end of this pandemic, but our personnel and resources are finite. I don't want ever to see a situation where our resources are exceeded by the demand for care. And unfortunately, that scenario is a very real and present possibility. But if we all do our part to protect one another, it does not have to be. Thank you for fighting. Thank you for your perseverance. Please stand firm and hold the line. The end is in sight. We won't quit fighting for you. I'm asking that every member of our community stand with us and do the same. God bless you. May the Lord continue to pour out His mercy on us.